All right, let's get into our next discussion. Now, the Nigerian Senate says there is an urgent need to support the Nigerian Center for Disease Control. And the Senate is worried about the fast spread of Lassa fever and wants the Ministry of Health to provide the center with all it needs to meet its responsibilities.
Now, Lassa fever has claimed the lives of 31 people in 15 states, while the total number of confirmed Lassa fever cases has risen to 105. Affected states include Edo, Ondo, Bauchi, Nasarawa, Imo, Kogi, Ebonyi, Anambra, Benue, Federal Capital Territory, Taraba, Ekiti, Abia, and, of course, Lagos and Delta.
That the center is confronted with the challenges of inadequate protective instruments for the health workers engaged in the management of victims. 2, inadequate drugs, that is ribavirin for patient treatment, inadequate disinfectants, and other infection prevention and control consumables.
That having a single center to take care of Lassa fever in a country of a population of over 180 million is inadequate. But when I look at the body of the motion, even that single center has a lot of teething problems. Basic requirements are not there.
So, Mr. President, I think this is a national emergency that the country needs to pay urgent attention to. But the motion is very exhaustive. Like Senator Polka said, even one center cannot be enough. However, the one that is enough, adequate funding, immediate adequate funding should be made to this.
All right, we have Ehi there, Chief Executive Officer, Occupational Health and Safety Managers, right here with us in the studio. Good morning, it's good to see you.
Good morning. Good morning.
And of course, we have in our Ondo State correspondent, Ayodeji Moradeyo. He'll be speaking with us later or via Skype. There he is. Good morning, Ayodeji Moradeyo.
Good morning to you over there.
Yes, indeed. Okay, let's start with you, Ehi. It's like the blame game has already started, over this Lassa fever outbreak, the fresh one that broke out in Ebonyi State, where Isaac Adewale, the health minister, is saying that the carelessness on the part of healthcare, providers and professionals has led to this latest outbreak. I wonder what your reaction would be to that.
I saw that yesterday, really, and I just laughed. He doesn't have the right to blame anybody. Everything begins and ends with him. Because from the report I saw that he made yesterday, that they knew it was going to happen, and since last year, materials were deployed, and people were trained on how to actually avert the occurrence of Lassa fever. If you really had the good intention, wanted to carry your program through, you trained people last year, and you stay in Nigeria, you don't live outside Nigeria, you stay in Nigeria, you're not seeing traction. You're not seeing traction from last year where you trained people until the outbreak. You're not seeing traction, you're not worried. Yeah. You didn't say a word. Now that we are faced with a public health emergency on this Lassa fever, you're coming out to blame game. No, it's not the right thing. When things go wrong, leadership should take responsibility. That is the best way to go about it. And look at how we can actually, take care of what we have at hand. Collectively, shifting blame from federal to state, it doesn't help any issue.
Especially when people have died.
Of course.
And there's a seeming or looming epidemic on our hands. Now, let me bring in Ayodeji Moradeyo, our correspondent in Akure, in here. Ayodeji, Ondo State is one of the states with the prevalence of Lassa fever. Can you give us an update regarding the nature of things there? What is going on so far?
Yes, in Ondo State, we have 9 cases have been recorded. Deaths, 9 deaths have been recorded, and 102 cases have also been discovered. Now the government is doing everything to ensure that the disease does not spread to other parts of the state. As I'm talking to you, we have Lassa fever reported cases in 8 local governments in Ondo State. And the governor came out in a media broadcast on Saturday to try to tell the people of the state that they don't need to panic, that they have to know what Lassa fever is all about. And the government is doing everything to ensure that the disease is curtailed. Let me tell you that as I'm talking to you, the emergency response team has been reactivated. And the government has also told health officials to move around the 18 local councils to ensure that reported deaths are well monitored, to ensure that when they are being buried, they know the type of, the kind of disease are actually infected these people before they die. So the government is doing everything to ensure that this thing is curtailed at this moment.
How much public enlightenment really is going on to you know, enlighten people on what exactly to do in the case of a suspected case?
Yes, for now.
Or even to prevent it. Yeah.
Yes, for now, the government has embarked on aggressive campaigns in the, most especially using the radio. You know, the radio is the most potent media to reach the people at the grassroots. So the government is doing this aggressive campaign on private radio stations, the state-owned radio stations, to ensure that people of the state are aware of the disease and that they're educating them that you don't need to expose your food. Most especially now, you have to stop eating or drinking gari at this moment, so that you don't, because you can't prevent it. You don't know how those people who sell this gari produce their gari. So you have to ensure that you stop drinking things that were exposed to you to Lassa fever. They also told them in the campaign, in the radio jingle, that you have to kill the rats in your homes. Get things to kill them and ensure that they don't move around in your various homes. So that's what the government is doing now. Aggressive campaign to ensure that people are really aware of Lassa fever.
All right, we'll come back to you on this. The issue of this spread this time around sees a lot of health workers, health practitioners being the ones spreading at the receiving end, also spreading further the disease.
Sorry, before I come to that, let me take what your colleague just said, the aggressive campaign. And that got me really shocked. I did mobile phones for public health at some point in my career. What do we have in common in this country? Mobile phone.
Yes.
If you look at the depth of mobile phone penetration in our countries, it's amazing.
Yeah, it's huge.
And the Western world is looking at why can't we deploy these resources as a public health tools? What we have right now, you're talking of radios. How many people, is it a woman that's going to the farm that will listen to radio? Or the man that's in the classroom that will be watching television? What we have in common is mobile phones. At this time of critical concern in this country, I expected that the government should be, we have all the telcos in this country, partner with them. Let this message be hitting your phone every 1 hour. Every hour you have message, Lassa fever is real, this is what we have. By the time you keep generating this information, people are able to know what's really going on and know what a way to prevent it. But now we're still looking at the old system of radio, television.
Listening to radio.
We have more than 70% penetration
social
depth.
media. You'll be very shocked and surprised how effective that will be if social media is deployed.
So I come to the healthcare issue, healthcare workers issue. Naturally, when these things happen, you have what you call nosocomial infection amongst the healthcare workers, which also acquired infection. That's why most times you see when there are diseases, healthcare workers who are on their own, that have no business with diseases, that they want that diseases actually end up with. And most times, the level of preparedness to manage these diseases is actually very poor. And you find that there are no, like you heard the House members were saying, there are no enough protective equipment, no enough training on how to actually protect such an epidemic when they happen. So you find out that people are actually caught unaware. And you find out that when they get involved, actually leaving themselves exposed.
Is it not because healthcare professionals themselves let down their guard when there's a disease outbreak? You know, everybody seems to wake up. You know, but when it's like it's gone, we all go back to square one. Or is it a case of the total lack of equipment and protective gears and all of that?
Before we get to the equipment, it's a man that is trained and knows how to use equipment. Let's go back. We talked about the head budget here the last time. Let's go back to where it all began. I mean, after our healthcare workers, how often are they subject to training? The budget we have for the healthcare in Nigeria is so meager that you can't even pull out funds to let me train people on new skills.
Barely 5% of the budget.
Diseases are mutating. I mean, for the past 4 years, we have had disease in succession, and we still have not learned from it. And I tell you, like I said before, we have Lassa fever right now. Everybody's running helter-skelter. As it subsides, you will never hear anything about this again. Public health is a huge field on its own. Let's start creating campaign, awareness. We shouldn't wait for the disease to happen before we start running helter-skelter. A man that has enough information about a certain disease or diseases, yes, knows what to do about that disease. Now we're talking about Lassa fever, but we already are aware that based on our geographical placement, Lassa fever is here with us. Since 1969, we've already had Lassa fever. It's part and parcel of our system. But why is it now that we are running the campaign when we knew that this work we should have done all the while so that
because it's been part of us.
It's been part of us.
Okay, let's. Ayodeji is still with us in Akure, our correspondent there. Now, you mentioned earlier that there's in fact, you used the word aggressive campaign to enlighten the people. Now, what is the response from the people generally when you evaluate the aggressive campaign? Especially, you talked about the issue of gari and then bush meat. We shouldn't eat bush meat and all of that. How are people reacting to all of this?
Let me talk about this issue of using radio to reach the people. Yes, social media is very good to reach out to the people, but you use social media to reach out to the learned people in the society. You know, radio is very potent. Like I said, that when you want to get to the people at the grassroots, you can be walking in your farm and you switch on your radio and you listen to whatever is coming from the radio. So radio is also very important. And those people are listening to, I think they are listening to all these messages from government to ensure that they do the needful. Like I said, the people of the state make use of the radio, the state radio stations and the private radio stations to get information from government. So the people are trying to ensure that they are very careful, that they don't just listen to the message alone. They also practice what they listen on through the radio.
All right, Ayodeji Moradeyo, thank you so much for joining us from Ondo State there. I'm even wondering whether, you know, Nigeria's rat population is definitely not even helping matters. Should we be laying more emphasis on the issue of hygiene?
That is the bottom line. Because when you have such issues, it's not just about rat. Rat will always be with you, but it's an issue of hygiene. Our hygiene level in this country is so poor. I mean, we took it up when Ebola came. And after Ebola, we came down. You know, most scholars actually said if only the country could sustain the level of hygiene they maintained during Ebola, Nigeria will be a better place. Nigeria is the only country where somebody finish using the convenience and want to shake you with their hands without washing it. Yeah. And I mean, these are things we should be looking at. These are things we should be talking about. These are core public health issues. When we actually take up our hygiene level, these issues we're talking about right now, they are preventable. The level of fatality, mortality we are receiving right now, they can be reduced to a barest minimum. Look at what we have right now, already about 405 suspected cases. I mean, we can't afford to go in this manner. I mean, from the words of the minister, 2018 alone, we have had 77 new cases. That brings it to an average of two new cases per day. We cannot manage this.
All right. Now, when it comes to the ability of the government to handle all of these things, it has become obvious over the years that government cannot. Okay, maybe government can, but government has not been handling issues when it comes to equipping the hospitals, building new ones, opening up all of those areas for access to health. Nigerians are concerned that in the health sector, the public-private partnership may not be working very well. I don't know what you have to say about that.
Partnership works on trust. Okay. But there is no trust, we can have partnership. And over the years, if you want to do a survey, look at those that government have actually partnered with, I mean, from the private sector participation. And you find out that a number of things have happened and everybody is becoming suspicious. So if you want to actually create partnership, you should first display that body language of trust and support. And when this happens, I'm sure private sector hospitals, they will open up to you. We have a lot of people in Nigeria. I mean, it's painful when I see this happen in Nigeria, and you wonder, what about the group of people we have in Nigeria that have this kind of skills? We have a lot of public health experts in Nigeria. Let's even look at it. When we're trying to appoint...
But isn't brain drain affecting them? Aren't they,
it is. I agree with you, but we still have
a
handful of people. When we're trying to appoint ministers, government functionaries into healthcare positions, we're quick to look at surgeons, gynecologists. But why do we take clinical people out of their clinical environment and bring them into public health space? When you give this role to a public health physician, he knows what to do. He's not waiting for curative approach to medicine. He's looking at preventive. So everything he's doing is geared two ways. When you put a clinician here, put a public health person here, the approach they both use is totally different because they are trained in two different manners.
We remember the days of Professor Olukoya Ransom Kuti when he was fronting the primary health care at that level, where in this country everyone knew about primary health care, was very popular, preventive medicine.
Yeah. But let's talk about the one and only center of excellence that Nigeria has when it comes to Lassa fever treatment or prevention or research and all of that. Is one really enough, considering that this disease is widespread? I mean, how many states already have been affected? 15. In past outbreaks, there have been more, more states affected. Should Nigeria be looking at creating more centers of excellence?
We should absolutely create more centers. Just imagine when you have to convey somebody from the north to that.
To Irua,
or get samples from Maiduguri.
I believe when things like this happen, it's not just to say, oh, it happened, we survived it. What are the lessons learned? You have realized right now that we don't have enough center of excellence. Let every region at least have 1 or 2 centers of excellence. So we'll have this, instead of conveying people from a distance of how many miles to just assess Benin, they may not even make it to that place alive.
Because there are complaints already that the Irua Teaching Hospital is
overburdened.
Overburdened.
And that is the truth. This is where we come back to poor healthcare infrastructures in Nigeria. We need to create more infrastructure, invest money into this, and let Nigerians at least have a level of comfort that government, cares, in this direction.
All right. Before we get into sports,
before Solomon comes to handle the sports, we have to round off our discussion with him.
Talking about the Lassa fever outbreak. Of course, 15 states have been affected so far, 31 deaths. While we went on that break, you were talking about us dealing with the real issue, especially how people handle food. I say food deliberately. This whole Gary talk, you guys are making Gary look bad.
I know,
but you were trying to explain, the way people spread out the Gary, dry fish, food stuff in the rural areas especially.
Where they are transported to the metropolis or township.
We also have to look at the source of food production. That's what I was trying to actually talk about.
Yeah.
Like the one I know, we'll take Gary as a critical example that we see in everyday life. Where you see people in the rural area, they've fried that Gary, and they now spread it on the highway that's not so popularly used, and they spread on the highway to dry them all. And the highway, you have plants everywhere, which of course you could have rats coming in there, and we have to look at that aspect. It boils down to the issue of hygiene. How do we store our food? How do we, most times we leave our food exposed at home, and most times it's not just because we want to leave them exposed, it's just a part of people's lifestyle. So we should try and scale up our hygiene level in our homes, in our schools. Now we should even be talking about it in the schools, because even, most schools right now are feeding the children. We have to be querying the source of the food they use in school. And the handling. So a whole lot of issues, we have to start dealing with at the same time. I'm so worried because the information we actually require is not coming. I'm not seeing it come. That's where I say I'm not seeing the information coming forth as I expect. People should be giving the information as at now, but we are not having that.
We remember the days of Ebola, where every radio station, every TV station, social media, every print, Ebola everywhere. And when it comes to issues like this, we also expect the National Orientation Agency, who has the primary responsibility of orienting people and informing people, to handle this.
You know, Mike, you know what I expected? At this point in time, government should be calling stakeholders meeting of the broadcasting outfit, newspaper publishing houses, social media, entrepreneurs,
bloggers, and all of that.
Bring them all together. This is our country. We have an issue. Let every hand be on deck. We have to enlighten our people. There must be one information source, and that's a control system. One information source. As you release information, maybe every day or twice a day, it circulates around the whole system.
Of course, that's why the Senate has stepped in to say that NEMA, for example, should visit the IRUA Center of Excellence, number one. And of course, it's made some recommendations that the centers of excellence should be spread out, in the country. And the issue of funding. No provision in the 2018 budget to fund prevention and treatment of diseases.
I was just about to say that the same senator that is saying this, the same senator was part of the people that saw the budget when it came, and they saw the percentage of that of that budget that was allotted for healthcare. What did he do? So now he's asking for, we should do this, we should do this. The budget came to you from the executive arm, and you were supposed to look at it. Why didn't you look at how come we have, it was really a figure right now that we have about 700 million people. How come we have 700 million people, 2.8 is why you're looking for budget? You should ask questions at that time. But now look at where we are.
Okay, well, we have to leave it here now. I know we'll be talking about this as we get along, but all the message that is going out so far, we hope that people are abiding by them, especially when it comes to hygiene. Because you said that is the basic, that's the bottom line. All right, then.
Yes, indeed. Thank you very much for coming around. We hope the next time we see you, we'll have some success stories. But there's something to share about now in Nigeria. Apart from the recession that is done and dusted, Forex reserve is looking up. Stay with us for all of that.